Hello and welcome to another episode of the Elite Health and Wellness Show. My name is Clay. I'm one of the owners at Elite Health Online, and this is Boomer Cornwell, my business partner and co-owner. We're excited today. We're going to be talking about the different routes of administration for testosterone. If you've been anywhere for any period of time and you're about already a hormone replacement therapy patient or you're considering it, you are very aware that there are multiple routes, and we're going to get into the pros and cons of each and discuss those. So stay with us. If we hadn't gotten to the one you're interested with, we'll be popping around and talking about all the different options. So, Boomer, one of the ones, I guess you and I, let's start with probably the one that I think particularly women and most people feel like they're going to hear about in their general practitioner or their OB office. Let's talk about the Bioidentical pellets or the pellet therapy.
Yeah,
let's start
therapy.
there.
Yeah.
You and I have a little experience in
We do. And so good, bad, or indifferent, a lot of what we do, is when we have a protocol or we have a product, we'll try it. Like we tend to try everything, right? So I think to kind of set the table, there's a whole slew of forms of administration, basically, right? I mean, there's injections, there's troches, there's creams, there's pellets, and there's probably other things I'm not even naming. And at the end of the day, it's really a simplistic idea because it's just a form of administration. Okay, here's the therapy that I need. How do I best get this therapy into my system? That's the only question that's being asked and that we have to address. So on the pellets, I mean, and again, some of this can be it can be a little controversial, so to speak, but it's not that the pellets are the end all be all. Okay, there's nothing wrong with pellets, but if you take somebody, and we'll use a female, okay, because a female doesn't necessarily know at 36 or 37 years old what it felt like to have testosterone coursing through your body the way that an 18-year-old male did, right? So we're going to be a little bit more sensitive to how we feel. I say that because whenever the women go to their primary care doctor or their OBGYN, they're going to recommend pellets. There's nothing wrong with that. And the very first time they get on that therapy, they feel great. But what's going to happen is the doctor is going to hone in on, that's the benefit of pellet therapy. No, it's not. It's not the pellets. It's the fact that
it's still testosterone.
It's HRT. It was what you've done, right? So the pellet therapy a lot of the times as a form of administration is fine, but we'll get into some of the pros and cons of it. But just right off the bat, remember, it's really nothing more than a way for that doctor to make some cash off of you.
So let's dig into it. So there is a theory out there. If you've bio-T, you'll hear it called a bioidentical testosterone. The first myth let's dispel about that is that all forms of testosterone are bioidentical. Whether you're doing injection, troches, or a cream, or pellets, the molecule of testosterone is identical, and it is bioidentical. It is the testosterone. It's like drinking water from that bottle or water from here. It's still H2O. It's testosterone. It's sold or pitched as bioidentical. The only difference in testosterone injectable is that it has an ester tail on it. It'll either have a cypionate, a propionate, and anthate, which will determine how long it's going to stay in the body and how slowly it's going to be released. Is it going to be released quickly or slowly? Pellets will release very slowly over months. Injections release faster over a week. So you take a week injection weekly, or you get pellets ever so often. The downside to the pellet, if you haven't experienced this as a patient, let's just be real, is when you get the pellet inserted, you're not going to notice the effects for several weeks. They're very slow release. And then when you hit your peak and they start to taper off, patients don't know when that's going to be. For someone that's super active and busy and works out a lot and is just high, just genetically, they may burn through that testosterone faster. So the doctor tells you, hey, you're going to need to come back in 3 months or 4 months or whenever you start to feel it. Now you got to feel like crap because you got to book the appointment, schedule the consult, go in, do your lab work, get the pellets inserted. Now you're 2 to 3 weeks back up. So while it's sold as this steady, thing, it's really not. You're going to have these peaks and valleys on either side of the injection.
Well,
or insertion,
and even at the very beginning of that too, let's just address this too. So at the very beginning of the procedure alone, it's a little bit invasive, right? I remember the first time I had pellets, I was a little bit nervous. In fact, I was actually pretty nervous because they're going to have to numb me. They're going to have to make an incision. They're going to have to stuff these pellets, into basically the side of your hip or your butt, right? And then tape you back up. And if you're, men typically get more pellets than women. So
it's a golf ball.
We'll have a little golf ball, bump in the side of our butt for a while. Well, one of the other things that can kind of go wrong too, and this happens periodically, is some of those pellets will break. And if those pellets break, it's a faster release of that testosterone, and now it's not going to last as long as they say it's
It
going to
also
last.
scars the area. I still, and my wife does as well, and I think most, I have areas from getting the pellets, and you can feel
Sure.
where they were
Feel the
inserted.
scar tissue.
And so over time, let's say someone starts at 35 or 40, you're not coming off of the therapy. You're going to get this done every quarter, or if it's a man, maybe every 6 months if you're really stretching it. That's a lot of procedures in both your hips.
Right.
And I had a patient just this week, remember, that I talked to a buddy of mine. His mom has been on pellet therapy forever. And she says, I'm running out of places to put them.
Yeah.
And we ride horses, and I can't hardly do anything for a couple of days because now they're having to insert them in different places. So that becomes a real issue. That's one of the downsides. So
It is. And another downside is this, that I've spoken to a lot of different providers that have told me this. And at the beginning, I was a little averse to this, but it makes a lot of sense now, is the fact that, once the pellet goes in,
yeah, there's no getting it out.
you've got a very, very short time to get that out. And we're talking like maybe a day or two.
Yeah, so if you're not having a great reaction.
If you're having a bad reaction, if all of a sudden you determine that you've got a health issue and it's, it's very counterintuitive to having pellet therapy, you're stuck. You ain't pulling that thing out.
So the pros are, I guess, once they're in and they're working, several weeks later after they start to release, and then you are steady for a period of time.
Yep.
But we just don't know when. But let's transition that to the shots. Okay, let's talk about shots for a second. Now, a lot of people feel that the pellets are, because they're sold as bioidentical, and my OB doctor's giving them to me, that shots must be on the edge. Is that even right? Can I even take a medication if it's an injection at home? Yes, you can. Might not have had a lot of medications in the past taken that way, but it's a very small needle. It's very easy to administer into the leg or the hip. It's pretty painless.
Yeah.
But the benefit here is within a week, patients are saying, oh my God, my libido. I mean, the very first thing they notice is usually libido.
Right.
A little more energy. It takes a couple of weeks still to get to your ideal level, but instantly they're going to feel the difference.
They are. And, again, one of the, you mentioned it, but one of the pros of the pellets is kind of set it and forget it, right?
Right.
So if you know that this is going to work for you or you want to do it, again, in a previous podcast, we talked about just start somewhere.
Yep.
So even if you start with pellets, start. We're not saying don't,
Yep.
okay? And the convenience of it is it goes in, and then once the golf ball goes down and the swelling goes away, you don't have to think about it again for, in some cases, 3 months, 4 months, 6 months, maybe, right? So that's a benefit. Yep. It is. The shots, I prefer the injections. Yep. I think I feel better on them. Yep. I think most of our patients do too. If there's a negative, it's that you have to do it.
Well, there's no doubt
week.
about that. I mean, yeah, right there. I mean, there's my wife, multiple patients, friends, family. Injections are, I think we would be misleading if we don't say, the preferred route of administration.
Sure.
I think any scientist, any doctor, if you really ask them, not if they're performing pellets and don't do injections, but if you ask an independent person, injection is the best form.
Oh, sure. Yeah.
Hands down.
Yeah. And really and truly, because the one aspect that can make it a little bit of a negative is also a positive. And here's what I mean by that. The protocol is going to be 1 injection a week or 2 injections a week. I think most people do 2 injections a week. That's you and I do, I know. And can that get a little bit of an annoyance? Yep. It can. Yeah. And you have to maybe rotate sites, right? I'll go shoulder, then leg, and then hip, and rotate, right? Doesn't bother me anymore. I don't really care. Like you say, it's quick, it's easy. But that's also a good thing, though, because, and this is one of the first providers that I ever talked to about this. This is why he liked injections over pellets, because you can control the dosing at that point, right? Because it does peak and valley. It tends to, right? With the injections. It's a good thing, because if all of a sudden you experience some type of a medical problem, or God forbid you're diagnosed with some kind of a disease, and it's counterintuitive to HRT therapy, then it's easy. You just stop taking shots and you're done. There's nothing to have to go pull out of your system anymore.
So let's pause there for a second. Those people that are interested in creams and troches, stay with us. We're coming back to that. I want to talk a little bit about the administration now. A lot of guys and ladies are just going to say, I just Sunday night, Monday morning, whatever your day of the week is, Wednesday, I just like to pull it out after the shower and sit on the edge of the tub and take the shot. I don't want to have to do it twice a week. And that is fine. That will work, and it works phenomenally. What you're talking about, splitting your shots or dosing, microdosing, there's a couple of different theories out there, and there's some science behind this. And so for some people, this may work. One, splitting your dose and taking a half a cc, which would be 100 milligrams of testosterone 2 times a week, does have some advantages. The bigger bolus of testosterone in your system is going to cause higher aromatization, which means you need more either anastrozole or DIM to control the negative effects of the estrogen, particularly in men. And so Shane Rusk has talked about this a lot from Vexapel. He does actually microdosing. He takes shots, I think, multiple times a week. You can do, this is something that the audience may not know. Injections do not have to be with a half-inch, intramuscular. You can do subcutaneous.
Sure.
But you can't do subcutaneous with a full ml.
Right.
You're going to have to microdose. You're going to have to take that ml over 3 or 4 different shots throughout the week. So Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, and do subcutaneous injections. And this is a little bitty diabetic needle.
Right.
That is tiny that you can do. So if you're really opposed to big, what you think is a big needle, it's not, then go subcutaneous. And the advantages of that is you're not getting the higher aromatization because of that big bolus of testosterone.
Well, and also too, I mean, we do have a lot of patients that they just don't like injections, man. And we hear that a lot, right? Hey, I love the therapy. I just don't like, I'm tired of giving myself a shot. Right. I don't like giving myself shots, man, And some of the clinics we've worked with will have patients actually show up to the clinic and ask to be injected at the clinic because they just can't do it themselves. I get it, right? So to your point, one of the benefits of the microdosing too is it's a little bitty insulin syringe. You just don't feel it, right? It's an injection, but the needle is much smaller. You go right into the subcutaneous fat. You literally do not feel it.
It's less than a bee sting.
Right.
Not even close to that.
Not even that. I mean, I would consider, the IM to be the bee sting,
So my sweet spot to talk to people is if we can do injections, that's not an issue. Let's start there. If you're going in and getting shots at a clinic every week and letting them inject you at the low T center, that's a lot. If you got that much time to let someone else inject you, I guess more power to you. But at some point, you're going to have to go home and inject yourself and save yourself all that time. And that's where we come in. Let's move down the line and my third option. I think my first is, might be my second option. Shots is number one.
Right.
Number 2 is creams. Let me talk about why for a second. Then I want to hear your experience. I've done the creams. I've tried them.
Me too.
They work. But remember, with a cream, it's instant. You're going to absorb it. And remember, your skin is a barrier. It's meant to be a protective barrier. So 1, are you an absorber genetically? That's the first thing. 2 is you got to put it on in Texas or, anywhere in the southern part of the United States and it's summer. You got to worry about sweat.
Yep.
You got to put it on 2 times a day. Okay, morning and night. Got to keep a consistent flow of testosterone. We can't just do it during the morning and forget the evening. So we got to split the dose. Has to be put in some private areas.
Yep.
Okay, for men and women to get the best absorption. And then you've got the sweating factor. Are you really getting what you think you're getting? Are you rubbing it in all the way? Are you not slipping on your underwear immediately afterwards? I mean, you've got to let it dry. You and I've talked about you want to talk about not a convenient procedure.
No.
Creams sound convenient. When you really understand how to do it, it gets pretty inconvenient.
Well, I think creams sound convenient because that's easy. That's just a topical. I mean, gosh, I put lotion on every day, man. I give me the cream, man. I don't want to inject myself. Well, you brought up a couple of interesting points. I'll bring up another one. You do have to do it multiple times, and while it may not be as invasive as say an injection, it's kind of annoying. In fact, it's very annoying because you have to do it once or twice a day, every single day, right? And pretty soon you're like, you know what?
Well, you're going to skip.
Forget this. Yeah, you can't not, right? I mean, you get busy, you get tired of doing it, you just don't want to do it, right? I've done them. I'm not opposed to the cream. What I've noticed, and maybe this is just me, is I've noticed some skin irritation with mine. So, my skin will get really, I'll put a little bit on the chest and the other areas that they recommend, but like my chest will break out and it kind of gets real red for a while. Not that that's that big of a deal, but the other aspect of it too that some people don't think of is you're going to have to scrub your hands really well after that because if it's on your hand and you go to pet the dog or hug your wife or something, you're transferring that. God forbid a baby, right? You're transferring what's in your hands to whatever it is that you're touching, and so many people are not thinking about that.
So again, it's a great option for people who just absolutely oppose, and I would say it's number 2 after injections if you're just anti and opposed, or you want to try something. Again, it's going to be in your system and out. So then we've got the troches, and the troches, boy, that was really an intriguing idea. You're going to put something under your tongue, let this little capsule dissolve, and it's going to go right into your submucosal and get into your bloodstream. But boy, are they problematic. And I would put them down at the very bottom of things I would do. Now, we offer them and sell them because there's just people that's the only route they're going to do. But through those, we've got 2 times per day and tons of hassles. And I know you're very aware of those. I don't know if you've actually tried them. But
you know what? Well, okay, so I've tried troches. I have not tried the testosterone troches, okay? And I'll tell you why. So, again, to your point, the whole idea of having a troche of any kind, but certainly any kind of TRT or HRT-based troche, it's sold on one aspect and one aspect alone, and it's convenience. Okay, I could pop this in my mouth. Okay, and I don't have to inject myself with anything. I don't have to rub anything on me.
If it were that
I'm
simple.
not getting pellets, but right. Okay, the problem is, what is the practicality of it, right? Because the fact is, well, there's a lot of different reasons we can get into. The reason I don't do the testosterone trochees is because I'm not willing to be as compliant as you have to be in order to make those things work. Okay, compliance means you can't have anything in your mouth for 30 to 45 minutes before you do this. And that means you can't have water. Okay. I can't get up in the morning and have a cup of coffee. You can't have brush your teeth, nothing in your mouth for 30 minutes. Then you put the trochee in that takes 20 to 30 minutes to dissolve. All right. Then you have to wait another 20 to 30 minutes. So and you got to do it twice a day. So twice a day, you're having to go
looking at like
an
a
hour
3
and
to
a
4
half
hour period of time throughout the whole day
without having anything even as simple as a drink of water, or that trochee is not going to work like it should.
Yeah. No, so this thing has to be timed. I mean, you know, midday and mid-afternoon, and you're traveling around with them. And again, if it's the only option, I would certainly consider that to be my therapy for testosterone. But creams would be above that. And certainly injections and then pellets. But
there are people who have high functioning engineer brains, not me, but maybe they can do that. Maybe they can say, I have no problem being compliant. I'd rather, fine. We're not sitting here saying don't do trochees. Okay. Again, like we said before, start with something. All right. Most people find that the compliance is hard or annoying and they don't want to do it.
Yep.
Yeah.
I agree. Well, I think this has been interesting. I hope the audience learned some things today about the different routes of administration of testosterone. This has been helpful. Again, so many people, don't understand the need to be the CEO of your own life and your own health. And you ask doctors lots of questions. The problem is when you go to most places, they offer one or two solutions at best, and they certainly don't offer all of them. What's unique about Elite Health Online, one of the options is we let you be the CEO of your own health. We offer all of these forms. You tell us which one works best for you and your lifestyle, and we'll help educate you on which one is the most effective routes of administration. But if that's just a no-go for you, then we have alternatives. And I really think that subcutaneous injection with the testosterone is just something that's just people aren't aware of.
I think so too. And the last point, and I'll let you wrap up, is, again, I said at the beginning, don't get too caught up in being sold on the idea of forms of administration, right? Again, if the idea is to get the testosterone or hormone that you're trying to take into your system, don't get wrapped around the axle about how you do it. You choose the most convenient method for you, and don't allow your provider to push a method that he or she likes because it's easier for them or maybe they're getting paid on it, okay? That's not taking ownership of your own health. That's not being the CEO of your own health, which is what we allow you to do at Elite Health Online. So choose the form that's best for you. We went over the pros and cons. I think it's very clear the one that we like, but you got to choose what's best for you at the end of the day.
Yep. Great stuff. All right. Well, thanks for joining today. We hope you find this podcast helpful. Check out our other podcasts that we have posted on YouTube and other channels. And we look forward to serving you. Check us out at elitehealthonline.com. There you can click book telehealth appointment. That'll set you up with the provider. Everything is telehealth over the phone. Our medications shipped directly to your door within 72 hours. You never pay for labs and never pay for consultations. Thanks for being with us, and we look forward to seeing you online.
See you next time.